Hi, I'm Dr. Scholz. Let's talk about prostate cancer. In this video, we're going to cover Azure prostate cancer that, in standard terms, is called high-risk prostate cancer. We don't really like that term high risk because it suggests there's a high risk of dying, which is truly not the case. The high risk is relative to the other, even more innocuous types of prostate cancer, like low risk and immediate risk. High risk means that there's a higher risk of relapsing after standard treatment, particularly after surgery. So, how are these risks calculated? Well, we subdivide Azure into three subtypes: low, basic, and high. In this video, we're going to cover low and basic, and we'll reserve high Azure for another video. You make a distinction between low, basic, and high with Gleason score and other factors. Specifically, to be a low Azure, that would be a favorable high risk, you need to have only Gleason 8, can't be 9 or 10. PSA has to be less than 40. Only a couple cores can contain Gleason 8 on the random biopsy, and neither can be over 50% replaced. And assuming one has had a multiparametric MRI, there can't be any extracapsular extension, seminal vesicle invasion, lymph node involvement. So if all those criteria are met, that is low Azure. Basic Azure is everything that's not low Azure or high Azure. High Azure means that you do indeed have something outside the prostate. PSA is over 40, or you have a Gleason 9 or 10. So let's start with low Azure, the most favorable type of high-risk prostate cancer. These are all men who are newly diagnosed. And with low Azure, we're looking at a treatment along the lines of someone who has a High-Teal. Standard fare would consist of a seed implant, intensity modulated radiation, and 4 months of hormone blockade, Lupron, Casodex type therapy. That is a fairly universal approach, and the cure rates are quite good. Many people wonder about using surgery for low Azure. And if anyone is going to undergo surgery for an Azure category prostate cancer, it should be low Azure only. As the Azure category rises, the risk of disease outside the gland is very high, and cure rates with surgery start to drop off very quickly. Before we move on to talking about basic Azure, in the low Azure category, there is now some preliminary research indicating that men in this category can benefit and have good cure rates with a seed implant alone. That is, to forego the intensity modulated radiation and skip the hormonal therapy. Unfortunately, we don't have phase 3 randomized comparative trials to confirm that this is as safe as it sounds, but there are a number of phase 2 observational trials that seem to be giving good results. So then, just to review, for low Azure, combination of short course hormone therapy, a seed implant, and IMRT would be considered the standard approach for low Azure. Backup options for people to consider would be either seed implant monotherapy, that's a seed implant with nothing added, or even perhaps radical prostatectomy, although I'm not a fan of that because side effects with surgery in general tend to be higher. Basic Azure is everything but low or high, and let's just reiterate, high Azures, PSA is over 40, Gleason 9, 10, disease coming outside the prostate, seminal vesicles, lymph nodes, and all of those people should be treated differently. Basic Azure, everything between low and high, is a seed implant, intensity modulated radiation therapy to the prostate and probably the surrounding lymph nodes, and hormonal blockade with something like Lupron for 18 to 24 months. And this is going to give the highest cure rates. And the reason that the cure rates are superior with this approach is that prostate cancer in the Azure stage can have microscopic spread outside the gland into the lymph nodes. So hormonal blockade, which circulates through the bloodstream, has an anti-cancer effect throughout the body. And if that's combined with some radiation to the surrounding lymph nodes, which is the most common jumping off spot for prostate cancer, the possibility of rescuing someone with early microscopic spread exists, and thus you're looking at a somewhat higher cure rate than simply doing surgery or simply doing radiation alone. So other issues for basic Azure, probably the most common type of high-risk prostate cancer, are considerations of a lot of different therapies. Options for radiation include proton, SBRT, IMRT, and whatnot. And the differences between these are so small that you can sort of think of them interchangeably. The real issues are to add the ancillary seed implant to boost the dose of radiation inside the prostate and improve cure rates there, to give some sort of beam radiation to the lymph nodes, and then to take systemic therapy with hormone blockade to cover both the lymph nodes and other parts of the body. So since we've been covering both low and basic Azure, the main differences in treatment selected would be shorter versus longer term hormone blockade, 4 months versus 18 months. And in some cases with Low Azure, although it's a bit avant-garde, men could even forego hormone therapy altogether and just undergo a seed implant without any additional types of treatment.